Part of what we see is hoarseness, and that's usually the chief complaint. But lately, I've been seeing quite a few singers in our performing voice clinic with complaints of pain, chronic pain. And it's typically related to some type of maladaptive compensation. So they might have something that's a little mechanically off, and then they are squeezing all the muscles of their throat to try and achieve the sound that they used to be able to achieve. So then they end up with chronic pain. One of the things that we find, for instance, with lesions is that people try to compensate for the fact that their vocal folds don't close by squeezing the rest of their throat together. And so I would help them to avoid squeezing so hard so that we could try to heal those lesions. So for instance, I might have them using a straw in a cup, blowing some bubbles for biofeedback to make sure that they're coordinating their voicing and their breathing instead of just using muscular tension to try and get their voice out. Prior to COVID, we had zero telemedicine. We weren't really set up to do it, and I think a lot of insurance companies were not paying for it. I know Medicare was not paying for it. Now, most of the practice that I do, as far as the treatment goes, is telemedicine. So I'm seeing up to 5 patients a day for 45-minute sessions on telemedicine, working with them on breathing retraining or voice retraining. The therapy that we do is not something that we can do in the clinic with masks on. I can't be wearing a mask when I'm trying to give examples to the patient, and the patient can't be wearing a mask when they're working on the exercises. Having telemedicine has made the difference between being able to take care of these patients and not take care of these patients. And I really feel that right now with COVID, it's essential, but I feel that after we're out of the pandemic, we're going to be using telemedicine quite a bit more. We're going to be able to use it to follow our surgical patients and to treat people who would have had to take many hours off of work to come to see us. The other thing that's been wonderful about telemedicine is that we can follow our surgical patients both pre and post with our own therapists. So typically if someone was in Spokane, for instance, I would send them to one of my partners in Spokane, but we would not be able to see them ourselves when we're the ones who are following the actual surgical results. Now with telemedicine, I can see the patient. I don't care if they're in Spokane. As long as they're in Washington State, we're covering the entire state now.
When I first started, it was very difficult to reach my high range, and it's getting easier between each session as far as speaking, singing. I feel like my actual speaking voice is a hair higher than when I first started. Yes? Yeah.